Today, I'll be taking you through the process of preparing your manuscript. And this, as you will see, will come through multiple processes. So we look at, once you have your paper and you want to get it out there. I think for disclosures, you already are aware, I am a deputy editor with the East and Central African Journal of Surgery, as well as with the Annals of African Surgery. So we'll get started. And so the assumption here is you have a manuscript. You've been working on a project and you want to submit this manuscript to a specific journal. And usually actually all journals have a standard format, and it's internationally followed. And the main thing is, as you can see here, a title page, an abstract, introduction, methodology section, results, discussion, any acknowledgements, references, figures, legends, tables of figures, and as well as what we call the appendices. So if you have additional information that is too much to fit on the main paper, you can sometimes attach them as appendixes at the end of your manuscript. Now, the title usually, cannot be too lengthy. And it gives an idea of the study, the main findings, and what you are trying to achieve. You can start with a little bit more general, as opposed to it being very specific. But usually most papers, by the time they're being published, they also want it that at a glance, if I look at it, I can see exactly what you're talking about. And then some journals, on top of having the long title, also ask you to submit a short running title, which they can now use in citing the paper. The abstract portion typically is around 120 words. Some papers, some manuscripts will give you like 300 words, 250 words. But in general, this is a brief summary of your entire project. It has the problem questions, the methodology, the findings. Now I put in brackets, no stats, but in some journals, they would like you to actually summarize your findings. Like you'll say 95% of the participants who are in this study were found to have particular cancer, and there was an association between this and this, and then a conclusion. So your introduction sets the stage. It looks at, say, we'll use esophagus cancer. What is the topic? What is the scope? Are we focusing in one country? Are we focusing in one region of the country? And what is the particular problem that you are focusing on your article? Use good prose, let it flow, let it be grammatical. Start, big picture, and then do linkages, because somewhere in your discussion, you will become more specific to exactly what your research study was able to find. And then you can give examples backed by prior data to prepare the reader for what is coming, and also for what you wanted to cover in your study. Then usually a brief review of the literature, what has been worked, who else has published, cite important research work that is pertinent. If you find that you are the only person who's done that particular work, it's the first ever, then you also mention that. And that takes us to the last part, which is when you identify the gap. So what is missing from the existing body of work, and why does this need to be addressed? So if you come up with a novel procedure that you are doing, which came about from you doing, say, 100 particular cases in this specific field, then you can say, in the past, everyone was doing it this way. We've discovered that we can do it in this particular way. It saves money, time, it's easier to do, it's easier to teach. And that's the area that you are addressing. Now, one way of finding what is missing is actually to read other published papers. Towards the end, they will say, we have done up to this point, and maybe somebody else would do up to this point B. And so that's one way of identifying the gap, and you can design a whole new study based on that question. And then in your own paper, you'll also say, at the end of the study, we found this, and these are the areas that we think should also be further explored. And then the methodology section essentially describes how your study will be carried out. Here you list the hypothesis, what was the particular question you are trying to answer, who are the participants, if it's procedure specific, you describe them, describe the equipment, and then you describe how you analyze the data. And very importantly, put enough detail so that the study can be replicated elsewhere. Actually, this is usually one of the key things when you're having studies, that you can be able to show others. Somebody else can do the exact same study and say, the study done by Mwenda et al., we found ABCD, and now we are continuing from this point and we have found this. And so that's one of the ways that scientific rigor is established. And then for your results, you, of course, will describe what you found, so present them in a logical order. If it's a qualitative versus a quantitative study, then use appropriate statistics based on your methodology. Use appropriate tests to describe what you found. And actually, I'll say here, it's a good thing to involve your statistician when you're designing the study and when you're preparing to write and submit, because remember, the reviewers will also critique and review the methodology and then look at how your results addressed the question and whether the tests that you use were appropriate for what you're trying to say. And so if they find any discrepancies, usually they'll come as comments. Reviewer will say, you are doing a qualitative study and you did not fully show us how you saturated the themes and how do you present such information to the reader. Then adhere to journal standard of reporting results. This can be found, and we'll talk about this in the instructions to authors. Some journals are very specific about, using a decimal point or using a comma or putting, 3 zeros, comma, or no commas. And, 1 million is written 1,000,000, or 1 million is written 1 million continuous, no commas. So these are important for you to adhere to. And then present the main points in tables and figures as appropriate, and also in a way that captures the essence of what you're trying to say. And if somebody looks at those tables, they can quickly say, oh, this study is highlighting ABCD. It's actually a good way. And now some journals actually have what is called illustrated. They allow you to do illustrations as part of your presentations, where you make a summary diagram that shows what you are trying to work at. And then the next portion is your discussion. So you'll summarize study questions and results. You can indicate the structure of your discussion at the beginning, or you can show it as it goes along. You can use subheadings if it will make it easier for people to follow your results. You can also discuss your results in reference to other work. So you'll say, we found this, and so because in this particular population, you found dysplasia was common in this subgroup, and so on, so found the same. This data is applicable, and if we were trying to make inferences for global adaptation, then therefore this means ABCD. So you can actually put your results in context. You can use minor points from your results to support your arguments. You can highlight areas where your results did not go as planned. And actually, one of the important things to also highlight is sometimes you can have a study that does not actually, a negative study. So you wanted to show this hypothesis and your study actually does not show it, and you can still publish it because others can see that somebody else has already done it and has worked on it. And then you can have a concluding paragraph, and also you can have a concluding statement, and you can also discuss limitations that you faced, and then consider giving recommendations and areas for future study or gaps that have been found in your particular paper. So for the process, so this is now general points about manuscript preparation. So as I said, always remember what is the question you are answering. All along, as you do your results, as you do your discussion, this should always tie to this question. And actually the conclusion of your abstract and the conclusion of your main paper should highlight that you've attempted to answer the particular question you've stated. Now, when you're beginning the writing process, before you actually begin to write, you can discuss the results with a mentor, a colleague, a supervisor, and see if you can develop a story. Like you can look at your data, and actually we used to do this a lot with many of the papers we've written. We say, okay, fine. What is the highlight we found from our results, and what is the angle we want to take with doing the discussions and focusing it out? So develop a story or a storyline, because it will make it easier to conceptualize when you're writing. I like this. I always do this, a bird's eye view of your manuscript. So, write out a draft general outline, and then you can begin filling in the spaces as you go along. And if you have multiple co-authors in your paper, this is also a good time to have them put in some input to your paper. Now, be sure to have the stats done to support your story. Cross-check them with a statistician. If there are questions that are arising at this point, you'll have questions from the reviewers, and so you can cross-check this. So here I say begin by writing the methods, because you already have this. So when you're writing a manuscript, sometimes it can be daunting, especially if you're doing this for the first time. So one easy way is the material you already have, the methods you have. If you have a protocol, it's simply to take the introduction from the protocol, put it into your paper. You can condense it a little. If you have the results, you can put this out. And then now you begin looking at the discussion. Then you can circle back and say, now that I'm looking at the introduction based on what I've seen in my results, how does it change a little bit what I want to say? Then find someone to proofread your manuscript. Your co-authors can do this. And actually, one of the things I like doing is to give papers I'm writing to people who are non-content experts. So if you're a surgeon, give them to a non-surgeon. Because even if they're not experts in that field, they will quickly pick out repetitions where your language style is not flowing or appropriate. They will actually point out places where the arguments are not congruent. So this is a really good trick. And so if these days there are people who are available to act as publisher reviewers, so they review your content and then they give you feedback, and then you work on the actual science that you want to put out. Avoid jargons that are not common. And if you use any acronyms, synonyms, you have to make sure you describe them at the beginning. If you use abbreviations, usually you make a list of them and you spell them out the first time that they're used. And then in future, you can now use the abbreviation. And for this, it's better to use standard abbreviations that are acceptable everywhere. Omit needless words, repetition, and this somebody else can help you pick out who's doing proofreading, and then make the structure, overall flow of your text. I used to call this style. Like there's a certain way, if you read papers from so and so, you can tell they wrote it. So you can have a flow that is very clear, and then give numbers and percentages and other appropriate things as needed. So you are putting together your paper, and before you get to the very end of writing the first part, you need to start thinking about the journal. And I bring this up because journals have specific criteria or how they want you to write the papers. And so it's good to know this before you go too far along. Otherwise, you might finish. For example, if you submit to Lancet and they tell you we use a specific writing style, and then you have to redo it all over again. If you know this in advance, you can reset that and write that as you go along. But we'll now look at journal selection and submission guidelines adherence in general. So how do you pick a journal? And I've put here, this is a good paper. If you have time, you should read it by Sweeter et al. 2019. They actually have a list there. So scientific rigor. This is, a key indicator of the quality of the journal is the rigor they have for publications published. The editorial quality, you can look at the board, you can look at their rejection rate, acceptance rate. You can look at the distribution of, the members of the editorial team, and you can also look at what they publish on their website for the peer review process, how many days to acceptance, how long it takes, what you should be able to do to submit a paper. And then the ethics around this, this is standard, approval required, need to be listed. I've talked about board members. And then the next one is journal reputation. So if you see a journal that is, and we'll talk about predatory journals further down, globally renowned and is, people say this is the paper to put your manuscript in, then it might push you towards putting it there. And then author rights and copyright, who owns this after you're done? Is it open access versus paid for? And then the indexing status, which I'll show you a little bit very shortly. So, and this is what I was talking about, is a target journal indexed. So you can search in the National Library of Medicine. For example, here, this is from this paper by Suter et al. They used the Missouri Medicine as the journal, and then they searched, then they clicked on current indexing status, and it actually lists when it was published, the frequency, since which year, where it is located. So they are very, the legitimate journals actually have a very good listing of the information that is needed. And then the other criteria, and this is now when you look at things like, what is the content? So if I'm trying to publish a paper on surgery, it will not be a good idea to submit my manuscript to a pathology journal because they will say, well, it's a good paper. It is not based on the subject that they cover. The other thing is visibility. For example, if you want a paper that is visible to African viewers or to American viewers or to international viewers, then you can select appropriately. And that goes with readership. Where are they best? Who do you want to target? And sometimes you might want to put a paper in a journal that is read by specific content readers. So if I want only to plastic surgeons to look at this, it's easier to put it in a plastic surgery journal. Now you can put it in a general paper, like for example, one that is on public health, and it might be accepted, but you might have fewer plastic surgeons reading your paper if you are wanting to have this content be viewed by plastic surgeons. And then, as I said, open access versus subscription, because open access usually requires you to pay some money, and the subscription models, they might have no charge, but they might be locked behind a paywall, so your readers might not be able to access. Then there's a thing we call the impact factor, and this is an important one. And so for the impact factor, essentially, this is calculated from index journals in the Web of Science and Scopus databases. And generally, these are based on the number of citations within a specific time frame garnered by the publications from the journals. So they do this calculation and they come up with a metric. And so, for example, I'm showing you here, these are all gastroenterology impact factors. This is this year. And you can see, the top 12 global journals listed. And most of them are actually British, American, and there's one Japanese one here, gastric cancer. And so this, you can decide, well, I want my paper to go into a high impact factor paper. So for example, American Journal of Gastroenterology, but getting in there might be a little bit tougher than, getting it into a local journal. So, but if you do get it in there, then you might be cited more. And you can see here, they've even told you which ones are open access and which ones are subscription. So specific journals have their own guidelines, and I've put here examples of the Eastern Central African Journal. If you click on the website on the authors here, it takes you to this page where you have instructions for the authors. And if I use an example of the American Journal of Gastroenterology, the same thing, you click on authors, it gives you another page and you can click to follow. So same for each of the sites has specific instruction and guidelines for the different types of manuscripts you want to submit. And so you need to decide, is it an editorial? Is it an original manuscript? Is it a case report only? Is it a video-based paper? Then they'll tell you, we only take 3 tables, 6 figures, 3 tables, 3 figures. What is their policy on disclosures, submission systems? Some journals actually allow you to publish your paper as is, meaning I submit it how I want. If it is accepted, then they make you put it into their format. And that might be good if you are in a hurry and don't want to take all the time to make it into their format. Or some say you must put it in a specific format that they want. And so once you've read the instructions for authors, for example, this is from one of the journals, and they tell you, what they would want in an article, introduction, methods, results, discussion. If it's a brief report, if it's a review, they tell you abstract not more than 250, main article not more than 3,000, references, review 2 and not more than 8 figures. So you can actually make your submission checklist, and you make all of these boxes and say, okay, does my paper meet all of this? And then once you do that, you can work on the areas that you've not met before you submit, because that reduces the amount of work that you will have to do once you get your paper back from the reviewers. COSEXA has a submission checklist for authors for our journal. And you can see here, I just took a screenshot of the top part. Has it been previously published? Is it a Word format? We've told you the font, the size, double spaced. Do you have a cover letter? Then disclosure forms, authorship criteria, conflict, and all of these different aspects. So you tick, tick, tick as you submit your checklist to the journal. And so the last bit about this is looking at the ethics, so when you're publishing and how to be a good, responsible author. And so I'll start by talking about the ICJME criteria. Now, if you go on the website, and most journals have this, they actually list 4 main elements. So I've highlighted in bold: substantial contributions to conception, design, acquisition, analysis, or interpretation of data, and that you drafted the work or you reviewed it critically. So somebody else might have read it, written it, but they sent it to you, you reviewed it for intellectual content, and you approved the version to be published, and you agreed to be accountable for all aspects of the work with regards to accuracy, integrity. Now, this is important because sometimes you might have say if you're junior and you have a very senior member of your department and they say, oh, you're about to publish a paper, I would like you to add my name. You can actually say, based on this criteria, we don't think you deserve to be an author in this particular paper. So it's important for you to be aware of this. Also, if you're left out, so say you joined a project, you contributed to it, you wrote some elements, you approved, but in the final paper, your name is missing, you can actually write to the editorial board and say, I met the criteria, but I was omitted, or so and so decided to leave me out. So this is why these ICJME authorship criteria are really important. The other considerations is author order, first versus last. Who did the main branch of the work? So usually the first author, like you see, these are 2 papers from the team when I was doing research out of Tenwek. And you can see here you have Bob Parker, myself, Russ White, and then you can see here same authors, but the order has changed. So in this paper, it means the first author did all the work, and in this case, he's a corresponding author. And Prof. White is the senior most author, so he gets to be the last. And then in this paper, I did most of the work, and so I get to be first author, and Bob Parker is second author, and you see the senior author is actually for this paper, Russ White and Sanford Dorsey. And then most papers cite, the first, these are usually the most visible, the first 4 names. And so you can look at your team and decide who did the most heavy lifting, and they get to be the first 4 authors. So in these papers, you can tell who the core team for each of the project. And this changes. If you have a large study team, you can decide to put them, like we can say African Esophageal Cancer Consortium. And so the other 72 names are listed as part of that group name, and therefore everyone gets to be cited. The other part is you can have joint first author. So say both of you worked equally in this project, then you can look for a journal that allows you dual first author. So both of you get to be first author and you share it equally. Yeah. Then let's talk about predatory journals. And actually, the other group that comes in is called the paper mills. You can see this is actually from this morning. I looked at my inbox, and you can see here this journal sent me. I found it in my junk mail, and they're telling me they want me to send them a paper by 30th of September. And you can see this other one that was sent on Saturday. Again, the same thing, that they are inviting me to submit a paper. They even put for you a nice impact factor. It looks very big there. But if you look at some of these channels, or if you go to their sites, you'll discover that some of them have some certain characteristics, which we'll talk about. And so we have two main terms, paper mills and predatory journals. So we'll start with predatory journals, and these are usually predatory publishing is a deceptive tactic used to exploit researchers, where you pay fees for their work, but they don't deliver enough editorial checks, controls, and usually don't have depth of appropriate peer review. The characteristics is usually direct invitation. So a journal you've never heard of, but they search online and see, oh, this guy writes papers in this topic, and they send you an invitation. Then a publisher producing many journals, many of them being new that you've never heard of. Very short turnaround times, usually 10 days to 14 days, and very quick guarantee to publish. And then high acceptance rate. So if you look, you see almost all the papers that are submitted there get published. And then you have direct invitations to submit a paper to a conference in some random place in the world that you're not familiar with, or multiple conferences. And then when you talk about paper mills, so essentially these are organizations that aim to profit from sale, peer review, citation of manuscripts, which may have low value, fraudulent content, and authorship, and with the aim of publication in scholarly journals. So they usually tell you they'll guarantee the publication or citations, but they do this for a fee. They allow you to choose your position and say, okay, fine, you can be first author or last author. Or sometimes they say, we'll publish you a paper as it is, just send it the way it is. And then authorship on a manuscript, which you know has already been accepted somewhere else, they say they want to republish it for you. So how can you tell from your emails what are the warning signs? And this is a good picture from this paper by Sweeter. Hyperbolic language, poor grammar, exclamation marks. Publisher logo is similar to an established journal, but not quite the same one. Vague impact score, or actually a high one. So they make it seem like a really high impact score. Inconsistent publication history. And then these referencing details are actually missing. So you don't have any ISSN numbers or DOI numbers for the publication. And then they ask you to pay first before they can do anything to get your paper published. And then now, as you all know, we have artificial intelligence. It's available. It's actually integrated into many, like PowerPoint has AI built in to help you write. So most journals now will ask you if you used it, to acknowledge it. And in general, if you've used large language models for any of your works, then usually you have to cross-check that the content is accurate, that there are no concerns about plagiarism, all sources are cited, and all statements in the article, reporting hypotheses, interpretations, results, conclusions, limitations, and implications of the study actually represent the author's own ideas. And this is one of the areas I would really encourage people to be really careful because there's, it's very easy to give AI a piece of information and tell it to generate something for you. And if you don't cross-check, then you can end up with a lot of issues. In general, you can use the large language models to augment what you're doing, but not to replace the writing process that you are working with. So plagiarism includes direct copying text from other sources. For example, this actual paragraph on plagiarism I cited from this PLOS journals. They have a page that they actually list this: copying ideas, images, or data from other sources without attribution. So using text from your own previous publication. So if you cite your own text, if you copy it and you don't reference it, it also counts as plagiarism. Exceptions, if you reuse text from the method sections, because you are saying we are going to do it based on, and then you describe, because it's very hard to change a methodology bit. And then using an idea from another source with slightly modified language, but without attributing it to them. So as we come to the end, and then I'll open up the floor for some discussions. I'll give you an actual example from a study that I did a while back. I think it's over 10 years ago. This study was called, so the actual title of the study was Study of Prevalence of Esophageal Squamous Dysplasia in southwestern Kenya. The short title was the STEP study. And this was a prospective study. We went out into the village, we recruited people, did questionnaires, they came in for endoscopy. And then for the methodology, we took biopsies classified by worst biopsy, calculated a dysplasia rate, and then adjusted it for age, gender, and age-specific prevalence. And then we looked at some multivariate, univariate associations with logistical regression. So this in general is what we wanted to do. This just shows you the actual process of doing the study team, collecting the material. Now, when I was done with the study, this is actually the first draft of this project. And you can see the title has changed. It became Esophageal Squamous Dysplasia is Common in Asymptomatic Kenyans, Prospective Community-Based Cross-Sectional Study. And so we made the first draft of the manuscript after multiple revisions. This is an example from the draft submission paper that I had. This was table 3 and 4 that we had prepared to submit. And we actually hit submit. And guess what? The first 3 journals in a row that I sent to actually decline. So the first journal declined this within, I remember it was 20 minutes. Like I submitted and I was not even done. And I saw an email. It was auto-rejected to the editorial stage. Like whoever received it just said, this is not the correct journal for a paper. To be fair, I was ambitious because I sent it to the Lancet. I thought this is the first study ever done in this part of the world. And so we should get into the Lancet. So I sent it in. The reject was in 15 minutes flat. And so we sent it to another journal. And they took a while. They took 2 weeks, but they sent a rejection. But this time it came with comments like, they said, we've looked at ABCD and we think it does not fit our journal, but you should consider submitting it to a 3rd journal. And after that, I submitted it to a 3rd journal. And this was actually the American Journal of Gastroenterology. And I show you here their author instruction page, which I had to go through. And then after working on the comments that I'd received from the first 3 journals, we submitted this and they reviewed it and actually they accepted it. So you see, and this is why I put this slide. Every cloud has a silver lining that you can use the rejections to help you improve your manuscript preparation. So don't be afraid to get rejections. Have a good mentor. Reviewer comments are good material for final improvement. And if you incorporate them, you can actually get a really good paper. And so this paper was actually accepted for publication in the Red Journal and was published. And actually turns out that at that time when we published this, it was the highest impact factor journal for gastroenterology globally at that time. And so it was actually a really good decision it ended up here and it actually got more citations than we had initially anticipated. So sometimes, things end up working well for you. So don't be afraid to get the rejections. They hurt, of course, because it will hurt your esteem, but eventually it gets things going. And this is actually from that paper. You can see here, they actually wanted an infographic. And for this, we got an actual, what are they called? Cartographer to do this. So these people who do maps, and it was a very fun process. So you send them the map of Kenya and they generated all of this. And then the journal sent me some instructions of how I can make this picture here. And this is actually what ended up being published, showing the different stages of staining that we had. So we've come to the end of the discussion that I had, but really I wanted to open it up for questions because this is more practical. And one of the things that I want all of us to do is look at a research topic that you have, can be hypothetical, can be the one you're currently working on, and do this for practice. So if you actually have a paper you want to publish, even better. So choose a journal, a target journal, go through the author instructions, develop the checklist, and then look at the project that you're working on and see if you can make it fit. And then, you can use that to work on. So I think I will ask Samuel if we can have discussions, comments, questions. Yes, that should have been the last slide on any of this. And hopefully we've been able to shed some light on the manuscript preparation and submission process.